Well, of course, we continue to follow the coronavirus outbreak here in Massachusetts. And to keep you informed, we want to answer some of your questions. Of course, WBZ is the only Boston TV station with a doctor on staff. We are so proud to have our Dr. Mallika Marshall. And our first question this afternoon, Doctor. Trish asks on Facebook, my 17-year-old has asthma. He plays 3 sports and he's in good physical shape. Is he considered to be compromised?
So we do worry that people with asthma might be at higher risk of getting really sick if they get infected with the coronavirus. But your son is young and he's got good physical conditioning, so he has both of those things going for him. But I would take extra precaution to make sure that he doesn't get infected and the people around him in his household, and make sure that he's up to date on all of his asthma medications and keeping his asthma under good control.
Good advice. He's young, he's in shape, but still has some issues there. Thank you, Doctor. And Kelly asks on Facebook, when are you considered not contagious? I had a cold last week, she says. It's gone except a little leftover cough, and I don't want to pass it along.
So we actually think that people are most infected or most contagious in those first few days of developing symptoms, and they could continue to shed the virus for a week or longer, even when they start to feel better. Most people who are diagnosed with coronavirus are told to stay at home for at least 14 days, but that can vary depending on the person. So I would advise you talk to your doctor, and you certainly should be wearing a mask when you're around other people if you're still coughing.
You don't want to be walking around coughing right now. People would not like that at all. Carlene on Facebook wants to know, has anyone established the benchmark for what needs to be seen in order for kids to go back to school? I'm just wondering, she says, if there's any hope. A lot of people doing the homeschooling are asking that question, Mallika.
Yes, we all want to know if there's some hope. So basically we have to see cases going down. And some health officials are saying that they need to consistently go down over a 14-day period. And hospital systems need to be able to diagnose, treat, and isolate coronavirus cases. So, you know, for some states that could be as early as May. For other states, kids may not be going home until the fall. Going back to school until the fall.
Yeah, we're seeing more cities and towns across the nation doing that. Heather writes on Facebook, should direct care ICU nurses and doctors who are working only with COVID-19 patients be out in public shopping? Would it be safer to use delivery services?
So first responders have to eat too. They need to get groceries, and if you've ever tried to order groceries, you know it can be incredibly difficult. But I would say that they are at higher risk of being infected with coronavirus, and so they just need to be really careful when they go out shopping. You know, go at a time when there are fewer people in the stores, wear masks, possibly wear gloves, and just take care to stay away from people as much as possible.
We know that you've done that. You're keeping your distance from your own family, which is sad to hear. Dr. Mallika Marshall, we really want to thank you for some great information.